Tinnitus, pronounced tinn-ih-tus or tinnitus, occurs when you hear sounds that aren't in your environment. You may hear ringing, buzzing, roaring, whooshing, swishing, clicking, or hissing. You may be able to treat your tinnitus naturally using acoustic therapy, alternative treatments, supplements, and dietary changes. However, tinnitus can be a symptom of a more serious condition or injury, so it's best to see your doctor to find out what's causing it. So, we are going to watch about the how to reduce tinnitus naturally. Method 1. Trying acoustic therapy. First is use calming background sound to drown out the noise. Mask the noise in your ears by turning on background music or other sounds. You can use tapes or CDs with white noise of the ocean, a babbling brook, rainfall, soft music or whatever works to help block out and cover up the sounds in your ears. Step 2. Listen to soothing sounds as you fall asleep. White noise or other soothing sounds can also be used to help you sleep. This can be important, as many people find it difficult to sleep with tinnitus. At night, the sound in your ears can become the only sound audible and can make it hard to fall asleep. Background noise can serve to provide a peaceful sound to help you sleep. Step 3. Try listening to brown or pink noise if other sounds don't help. Brown noise is a collection of randomly generated sounds and is generally perceived as much deeper sounds than white noise. Pink noise uses lower frequencies and is also perceived as deeper sounds than white noise. Either pink or brown noise is often recommended to help with sleep. Find examples online of both pink and brown noise. Choose the noise that sounds best to you. Step 4. Avoid loud noises because they can worsen tinnitus. One of the most common triggers for tinnitus is the presence of loud noises. Avoid these as much as possible. Some people may not be affected by loud noises, but if you do experience worsening or aggravated tinnitus after hearing loud noises, you'll know that this may be a trigger for you. Finally, look into music therapy to help prevent chronic tinnitus. A German study involving music therapy in tinnitus showed that music therapy employed in early cases of tinnitus can prevent that tinnitus turns into a chronic condition. This therapy involves listening to your favorite music with its frequency altered to center on the same frequency as the ringing in your ears. Method 2. Trying alternative health treatments. First is get a chiropractic adjustment if you have temporomandibular joint (TMJ) problems, which can cause tinnitus, can be successfully treated with chiropractic treatment. TMJ problems may trigger tinnitus because of the proximity of muscles and ligaments that attach to the jaw and the hearing bones. A chiropractic treatment would consist of manual manipulation in order to realign the TMJ. The chiropractor might also manipulate the vertebrae of the neck in order to decrease the symptoms of tinnitus. Chiropractic adjustments are not painful, but they may cause some temporary discomfort. The chiropractic treatment may also include the application of heat or ice and specific exercises. Chiropractic treatments can also help with Meniere's disease, another less common cause of tinnitus. Step 2. Visit an acupuncturist to potentially get relief. A recent review of studies of the success of acupuncture for tinnitus concluded that there was some cause for hope. Acupuncture techniques would vary based on the underlying cause for the tinnitus. These techniques also often include traditional Chinese herbs. There's no guarantee that acupuncture will help. Step 3. Ask your doctor about aldosterone if you may have a deficiency. Aldosterone is a hormone found in your adrenal gland that regulates sodium and potassium in your blood. Aldosterone deficiency may cause tinnitus, so taking a supplement may help you find relief. Talk to your doctor if you think you may need more aldosterone. Finally, try personalized sound frequency treatments. There is a relatively new approach that may be useful for some. The idea is to find the frequency of the particular sound in your ears and masking that specific frequency with specially designed sounds. Your ENT or audiologist may have recommendations about these treatments. You may also find these treatments available online for a fee through websites such as AudioNotch and Tinn-ih-tus. These services walk you through testing for the specific frequency of your tinnitus and design a treatment protocol. Method 3. Trying supplements. First is take CoQ10 to support cell growth. Your body uses CoQ10, or coenzyme Q10, for cell growth and maintenance. It is also an antioxidant. CoQ10 can also be found in organ meats, such as heart, liver and kidney. Try taking 100 mg 3 times a day. Step 2. Try ginkgo biloba supplements to increase your blood flow. Ginkgo biloba is believed to increase blood flow to the brain and has been used to treat tinnitus with variable results. This is likely because tinnitus has many known and unknown causes. Follow the manufacturer's instructions while you are taking this supplement. Step 3. Increase your intake of zinc to help relieve your tinnitus. In one study, almost half of tinnitus patients improved with 50 mg/mg of zinc daily for 2 months. This is actually a rather high dose of zinc. The recommended daily intake of adult males is 11 mg, and for females, the recommended dose is 8 mg. Don't take this amount of zinc without talking to your doctor first. If you do take this high amount of zinc, don't take it longer than 2 months. Balance your intake of zinc with copper supplements. A high intake of zinc is associated with copper deficiency and copper deficiency anemia. Taking the extra copper will help prevent that. Take 2 mg of copper every day. Finally, try melatonin supplements so you sleep better. Melatonin is a hormone that is involved in the sleep cycle. One study indicated that 3 mg of melatonin taken at night was most effective in men without a history of depression and those with tinnitus in both ears. Method 4. Changing your diet. First is avoid salty foods because they may cause high blood pressure. It is generally recommended to avoid salty foods because of their association with high blood pressure, which can cause tinnitus. Step 2. Eat a healthy, whole foods diet. A reasonable recommendation is to eat a healthy, whole foods diet low in added salt, sugar and saturated fats, and to increase the amount of fruit and vegetables in the diet. Finally, try cutting down on coffee, alcohol and nicotine. Some of the most common triggers for tinnitus include coffee, alcohol, and nicotine. Avoid any and all of these as much as possible. We don't really know why these are triggers for different people. Because tinnitus is a symptom of a number of different possible problems, the reason these are triggers may vary on an individual basis. Cutting out these substances may not improve your tinnitus. In fact, one study showed that caffeine was not associated with tinnitus at all. Another study indicated that alcohol may actually help relieve tinnitus in older adults. At a minimum, watch what happens if you have any coffee, alcohol or nicotine, especially being aware of what happens to your tinnitus after you indulge in any of these. If the tinnitus gets worse or harder to deal with, you may want to consider avoiding those triggers completely. Method 5. Finding support. First is understand what tinnitus is. Tinnitus can range from very loud to very soft sounds, can be loud enough to interfere with normal hearing and be heard in one or both ears. You may hear ringing, buzzing, roaring, clicking or hissing sounds. There are essentially 2 types of tinnitus, subjective and objective tinnitus. Subjective tinnitus is the most common form of tinnitus. It can be caused by structural ear problems, in the outer, middle and inner ear, or by problems with the auditory nerve pathways leading from the inner ear to the brain. In subjective tinnitus, you are the only person hearing the sound. Objective tinnitus is much rarer, but can be perceived by a physician during an examination. This can be caused by vascular problems, muscle contractions or conditions related to the inner ear bone. Step 2. Try cognitive behavioral therapy and tinnitus retraining therapy. Cognitive behavioral therapy, CBT, is an approach that uses techniques such as cognitive restructuring and relaxation to change a person's response to tinnitus. Tinnitus retraining therapy is a complementary practice that helps desensitize you to the noise in your ears. The therapist will teach you different ways to cope with the noise. This is a process in CBT known as habituation, where you can learn to ignore the tinnitus. The therapist will teach you about your tinnitus and will teach you a variety of relaxation techniques. This person will help you adopt a realistic, effective attitude in dealing with tinnitus. Your therapy may not affect the level of noise, but it can help how you respond to the noise. CBT can help relieve your anxiety and depression so you feel better. A combination of sound therapy, background noise, plus CBT typically provides the best overall results. Step 3. Join a support group. You might find it useful to find a tinnitus support group, especially if you are experiencing depression or anxiety associated with the tinnitus. This support group can help you develop tools to cope with your condition. Finally, see a mental health professional if you have anxiety or depression. Anxiety and depression can be associated with tinnitus and vice versa. If you are experiencing these symptoms, make sure you seek out professional help. Usually, depression and anxiety exist before the tinnitus, but these conditions can follow the onset of tinnitus. The sooner you get treatment for tinnitus, anxiety and/or depression, the sooner you can begin to feel and function better. Tinnitus can also make concentrating difficult. This is where cognitive behavioral therapy can be very useful, providing different tools and resources to cope. Method 6. When to seek medical care. First is see your doctor if tinnitus symptoms are bothering you. You might experience short-term tinnitus that goes away. However, Tinnitus that persists can be really annoying and may make it hard to live your life. Fortunately, your doctor may help you create a treatment plan to help you find relief. Visit your doctor if you have the following symptoms: ringing, buzzing, clicking, hissing, roaring, humming. Step 2. Visit your doctor if tinnitus suddenly appears after a respiratory infection. You might experience tinnitus after a cold, the flu, bronchitis, or another respiratory infection. When this happens, your tinnitus should resolve quickly. However, you need to see your doctor if it persists. Let them know that your symptoms were triggered by a respiratory infection. See your regular doctor first. However, they may refer you to a specialist such as an ear, nose and throat specialist, ENT specialist, or otolaryngologist. Step 3. Get immediate treatment for sudden tinnitus, hearing loss, or dizziness. While you likely don't need to worry, these can be emergency symptoms. You may have an injury or illness that's causing your tinnitus. Fortunately, your doctor can figure out what's causing your symptoms to help you recover. See your doctor for a same-day appointment or go to the emergency room for treatment. Again, try not to worry. These symptoms may be temporary, but it's best to be safe. Step 4. See your doctor if your tinnitus causes other symptoms. Tinnitus can cause complications, which might interfere with your life. If this happens to you, your doctor may be able to help you find a treatment that gives you relief. Talk to your doctor if you experience any of the following complications: fatigue, stress, insomnia, trouble concentrating, memory issues, depression, anxiety, irritability. Step 5. Get a diagnostic test from your doctor. The doctor will likely physically examine your ears with an otoscope, a lighted instrument for inspecting ears. You may also undergo a hearing test and potentially some imaging tests such as an MRI or a CT scan. In some cases, more extensive tests may be necessary. In general, these tests are not invasive or painful but may cause some discomfort. Common causes of tinnitus include Meniere's disease, temporomandibular joint, TMJ, disorders, head and neck injuries, benign tumors, and hypothyroidism. In some cases, tinnitus can be caused by aging or age-related conditions, like menopause. Step 6. Tell your doctor if you've been exposed to loud noises. Loud noises can contribute to tinnitus, so it's important that your doctor knows if you have this risk factor. Discuss your current and past exposure to loud noises and ask if it may be to blame. For instance, working around loud construction equipment or attending concerts may trigger tinnitus. Your doctor may recommend you avoid loud noises in the future if you have tinnitus. Step 7. Ask your doctor about blood vessel disorders as a possible cause. Many disorders that impact blood flow can cause tinnitus. If you have a blood vessel disorder, your doctor may be able to offer you treatment options. Talk to your doctor about the following disorders: head and neck tumors that press on blood vessels and change the blood flow, atherosclerosis or the buildup of cholesterol-containing plaques on the insides of arteries, high blood pressure, anatomical variations in the carotid artery in the neck that can cause turbulence in blood flow, malformed capillaries, arteriovenous malformation. Step 8. Check if your medications may cause tinnitus. Many medications can cause or exacerbate tinnitus. Your doctor or pharmacist can help you understand your risk for this side effect. So talk to your doctor about the medications you are taking. Some of these medications can include aspirin, antibiotics, such as polymyxin B, erythromycin, vancomycin and neomycin, diuretics, water pills, including bumetanide, etacronic acid and furosemide, quinine, some antidepressants, chemotherapeutics, including meclorethamine and vincristine. Step 9. Treat your underlying condition if you have one. Some causes of tinnitus can be treated, so you may be able to relieve your symptoms. This will also help you avoid complications from your condition. Ask your doctor about potential treatment options for your condition. For instance, you may be able to try the following: earwax removal for built-up earwax, blood pressure medication for high blood pressure, medication for atherosclerosis, changing medications if you're having side effects. Finally, get a hearing aid if your doctor recommends it for you. Hearing aids may help your tinnitus, but they aren't right for everyone. Your doctor will likely refer you to a licensed audiologist to have your hearing checked. They'll determine if a hearing aid can help you. Use your hearing aid as directed by your doctor. It's possible that your tinnitus is caused by hearing loss. If this is the case, a hearing aid may help. We hope it is useful to you. Please subscribe to our channel to upskill yourself.